Hello, this is a re-recording of the original talk I gave on 20th July, which was the inaugural edition of the Doctor Is In webinar series. It was my first recording, and since then I've learned a lot more about recording and videos and YouTube, and so I thought I'd re-record this to improve the quality of this first session. These webinars have two parts. The first is me giving a brief presentation on a topic that is pertinent to health and human trafficking, broadly speaking. But the best part about this series, however, is the second part, and it's the part you won't see here. It's the live question and answer session, which follows my talk. And these are open for people who are joining my session live, and they are asking general questions about human trafficking, specific questions about an issue they're dealing with, or for more clarity about something I mentioned during the teaching session. So I'm very excited about where this is going, and I'm looking forward to a long series covering a wide range of topics. Relentless is a counter-trafficking organization, and I'm a physician, so naturally this is the intersection in which I work. However, so many issues relate to these giant topics is that it's impossible to silo them neatly, nor should they be siloed. Human trafficking encompasses a wide range of issues, and healthcare is not just about caring for sick people. I'll be wandering through these topics and providing some clarity, but sometimes we'll wind up with more questions than answers, and that's okay too. We still have quite a lot to learn. Today I'm going to start at the 34,000 foot level and discuss various intersection points between healthcare and human trafficking. And throughout this series, we'll be discussing other broad topics such as prevention, as well as practical topics that address the daily nitty-gritty work that a lot of frontline practitioners are dealing with. We need to broaden our idea of counter-trafficking work beyond law enforcement, legal issues, immigration, and justice departments. We need to broaden our idea of beyond getting just the bad guys. Access to justice means access to all determinants of social well-being. That includes healthcare. Slavery is a law enforcement, immigration, and social issue, but it's way more than that. It's a healthcare issue. This is the lens through which I see things and hope to bring this perspective to the table on a global level. Most people probably automatically think, as I did when I first started in counter-trafficking work, that to be a good health provider working against human trafficking meant that it was all about being a physician who is caring and available and kind to survivors, perhaps willing to work odd hours for little or no remuneration. It didn't take long before I discovered that good work goes much deeper than that. Healthcare is a sector of civil society that has largely been overlooked in addressing slavery and exploitation today. Although many healthcare professionals may know about this issue, they may be unaware of how they can leverage their skills against it and that they have a unique and important role to play. We can make this issue relevant to health professionals, and they need an invitation. One of the goals of Relentless is to engage healthcare professionals around the world to learn about what they can do and then mobilize them against modern slavery. Another goal is to get counter-trafficking organizations to realize the great resources that healthcare professionals can bring to the work against slavery. We're not just technical people to help fix mental or physical health problems. Of course, we need to be good at that. But we also bring a different perspective and different ways of approaching problems. Everyone has valuable skills and perspectives, and we need everyone to be engaged collaboratively. So what are the different facets of health and human trafficking? Perhaps intersection is not the best analogy because it connotes only one point. I can think of half a dozen off the top of my head. And today I'm going to discuss a brief overview of these facets, and we'll be diving down into these topics in more detail in future webinars. So as healthcare professionals, we are clinicians, educators, advocates, and researchers, but non-healthcare professionals have a lot to learn from the way healthcare professionals address situations. And so these intersection points cover all of our roles and then some. The first and probably most important is to be aware of trauma-informed care, what it is, and how we implement it. Providing great clinical care can be quite a challenge if the physician is not aware of the complexities and comorbidities associated with chronic trauma. Because trauma induces psychological as well as physiological pathologies, patients often have symptoms that don't fit a particular syndrome or are more complicated than usual, and don't necessarily respond to typical treatment protocols. This can frustrate physicians who have a one-sided somatic approach to illness. Furthermore, it's simply not enough for health professionals to provide competent clinical care to survivors. Care must also be trauma-informed. Trauma-informed care is given in a way that recognizes that an individual likely suffers from trauma and creates a safe place for both provider and patient to work. It also recognizes, if you don't know the patient's been traumatized, it recognizes some of the trauma reactions that can come up. Unfortunately, I've learned the hard way about what it means to be a good doctor, and I've screwed up, and hopefully I'm learning too. Every encounter with a survivor can be a step in their healing process, or not. It's important to realize that healthcare professionals can inadvertently traumatize their patients or re-traumatize them. There are several ways this can happen, and unfortunately it's easier to do than you think. I know, because as I said before, I've made some egregious errors, and I continue to learn all the time. Prevention is another important facet of this intersection. Human trafficking can be prevented, and applying the principles of public health to address human trafficking provides a very comprehensive approach to prevention. It's well known that adverse childhood experiences are a huge public health problem and creates vulnerabilities and conditions in victims so that these children have an increased risk of being trafficked. Unfortunately, some of these children also have an increased risk of becoming perpetrators themselves. Another way to reduce the risk of human trafficking is to address outrageous medical debt that sends families into crisis and looking for extreme ways to generate income. Other ways including advocating against practices such as child marriage, volunteerism, and promoting greater transparency in adoption practices and other ways to protect children from being trafficked. Research is a third facet here. Much more research is needed to be able to understand the health consequences of human trafficking, as well as improve evidence-based care of survivors. The research needs to be done across various sectors of human trafficking: labor, sex, forced marriage, and other issues. And it needs to be conducted in different geographical regions and various cultural settings in order to better specify, for example, identification methods or best treatment practices. And identification is another key area where healthcare and trafficking intersect, because healthcare professionals are on the front lines of human trafficking, in that we are in one of the sectors with whom trafficked people may interact. In fact, a relatively high number of trafficking survivors report that they saw a health professional during the time that they were trafficked. And when we don't see them, there are missed opportunities to help them. They may be visiting an urgent care center, a crisis pregnancy center, or have an accident at work or in the hospital. They may be visiting an urgent care. Many articles and training opportunities exist, and they help equip healthcare professionals to learn how to identify someone and make a safe referral. It's important to add that safe referral means full consent. Just because you've identified someone who may be in a trafficked situation doesn't mean that they see themselves in the same grave danger that you see them. And in order to make a referral and to make it safely, consent of the patient is of utmost importance. Organ trafficking is a form of human trafficking that is absolutely germane to medicine, and yet the healthcare system is largely silently complicit with the organ trade. We can do much more within our profession to stop this egregious crime. Awareness and advocacy is another important ways for healthcare professionals to get involved against human trafficking. Healthcare professionals can be great advocates for healthcare rights of survivors and the special needs they have. When hospitals and clinics are aware of the vulnerabilities of trafficking victims and survivors, they can be more proactive to decrease the size and number of gaps in care. Referrals are facilitated more rapidly, continuity of care is improved, and multidisciplinary encounters are encouraged. Finally, training and equipping of other healthcare professionals is vitally important. There's many scholarly articles about the physical and mental health needs of trafficking survivors and they've been published in academic journals. However, this sector remains relatively small and obscure, and the gap is widest in lower income and lesser researched countries, and the need there is even greater. It's necessary to tap into the deep well of health professionals who don't yet know about this issue, or they don't yet grasp why it's important for them to know about it or care about it. And finally, we need to let them know all the amazing things they can do about it. There are, of course, many other points of intersection, but I've outlined these as large platforms from which we can dive into more deeply later. To summarize, it's trauma-informed care, prevention, research, identification and referral, advocacy, and training and equipping. It's important to remember that every encounter with a survivor can be a step in their healing process. I wouldn't be in this work if I didn't think I was making a difference. Healthcare professionals have a unique and important role to play to counter human trafficking. When we are united in a movement against human trafficking, then we will be empowered and phenomenally effective to prevent slavery, to interrupt its destruction, and to care for those affected. Please join this movement. There's a wide variety of resources available for health professionals as well as lay people to learn more about the aspects of how the healthcare sector can work against human trafficking. So please visit my website or be in touch with me if you'd like more specific information about how you can help or how to get involved. I'm also keen to hear your feedback about future topics or other ways to improve this webinar. So now for the questions, and we'll see you in 2 weeks.